Chumai, Kuyana Telechi. Hello, and thank you for coming today. My name is Amy Chabitnoy. I'm a family physician at the Seattle Indian Health Board, and today I get the honor of talking with you guys about the many different paths of becoming a doctor, from high school through undergrad to medical school. I'll start by giving a little bit of my background of how I became a doctor, my journey through medicine, and then I'll talk about some of the many different paths that are available for anyone. So I am an Aleut enrolled member of the Tangirnaq Native Village, and I grew up in Pennsylvania. I went to a small liberal arts school in Pennsylvania for 4 years called Franklin and Marshall. I took 1 year off and I did research and then applied to medical school, where I went to medical school at Dartmouth in New Hampshire for 4 years. And then I applied to residency in family medicine. I was very drawn to the Seattle Indian Health Board for its mission to help American Indian and Alaska Native individuals, as well as their mission as a federally qualified health center. So that is my journey, and it's just one of the many different journeys to come into a path of medicine. So how do you get to become a doctor? What is the steps after high school? There are many different ones, but all medical schools have the same basic requirements, and then each medical school has an individual set of requirements, such as number of volunteer hours, number of shadowing experiences, and other things of that nature. In general, medical schools will require a 4-year undergraduate degree at an accredited institution. They'll require 1 year of biology, 1 year of English, and 2 years of chemistry. Some require a test called the MCAT, which I'll talk about a little bit later, but not all of them, and there are some ways you can get into medical school without taking that beast of a test. And you'll notice one thing is that I didn't say it requires a specific undergraduate degree. So that's the first myth I want to bust, is that you have to have an undergraduate degree in the sciences to become a doctor. Now, my undergraduate degree was in biology, so it's not uncommon for folks to choose a degree in the sciences, such as biology, chemistry, physics, psychology, sociology, any of those, but it's not required. And actually, thinking back, I wish I had taken more classes outside of biology. I would have loved to pursue some history courses, some literature courses, anthropology. So your options are very much what you are going to enjoy in your undergraduate degree. So you could be a dance major if you wanted. You could be a history, political science, anything that's going to give you joy in your undergraduate degree, you can be. So say you are a dance major and you didn't take those classes that are required in medical school. There are a number of options for you to go to medical school and complete those requirements. Some of the options for you involve a post-baccalaureate program, which is a specific 1 to 2 year program that has different aims to help students get into medical school. So for some students, it is to help them get the academic requirements they didn't get in undergrad, such as those courses that are required. Maybe you did take those courses in undergrad, but you didn't do as well as you had hoped you would do. So some of these courses, these post-baccalaureate programs, are designed to enhance your academic performance, to give you a step up on your application to medical school. And some of them are more targeted towards specific student populations, particularly underrepresented students in medicine, to help give them the support that's required for the process of applying to medical school, because it's confusing, it's long, it's hard to know what to do, and not all of us have someone who was in our family who went through the process. Maybe we're doing this for the first time. So some of these post-baccalaureate programs have assistance with mentorship, counseling, help you with your applications. They can do MCAT preparation courses for you. And they can also help with the financial aid assistance application and other things to help finance medical school. So there are all sorts of wonderful programs, and you can do it part-time or full-time depending on your schedule. There are other options, including master's degrees. So sometimes you finish undergrad and you're not quite sure you want to be a doctor yet. You're thinking about it. Some people go on to do a master's. They can do a master's in public health. They can do a master's really in anything, master's in business administration, fine arts, whatever it is. Some people choose to do that while they're thinking about medical school. There are also some pathways of going from undergrad straight to medical school. And these are combined bachelor's and MD programs. And there's several throughout the United States. In these programs, you apply as a high school student to the combined program. And what happens is you get accepted to the combined program. So you'll go to the college and you usually do an accelerated 3-year course where you do all your prerequisites for medical school. And then after you complete that, you go right into the medical school curriculum. And so in these, it's nice because you don't have to do another application. You don't have to apply. You're already accepted to medical school. You don't have to take that MCAT test I'm going to talk about here in a bit. And it's kind of nice in that regard. It is about a 5 to 7 or 8 year program depending on the school. So it is a lot of learning all up front. So I keep talking about this MCAT. So what is it? It's also known as the Medical College Admissions Test. It is a standardized test that helps give you a score to add to your application for medical school. I hate standardized tests. I find that they are not the best judge of a person's ability to become a doctor or to be a good medical student, but unfortunately it is the system that we are in, and you will take many standardized tests throughout your career in medicine. You'll take standardized tests to get into medical school, and then in medical school, and then to get into residency, and then to keep your license. So, and as unavoidable as standardized tests are, this will be the start. It is a 7.5-hour test that is computer-based, multiple choice, and it tests 4 different areas, a lot of the biology, chemistry, social sciences, and English components. Some people will take preparatory courses for the MCAT, so they take an MCAT course online or in person. There are books to help guide you, and usually people spend a good chunk of time, a month or more, studying for this test. It's offered multiple times throughout the year, and you can take it more than once, and the score is also good for 3 years. So say you graduate from undergrad, you didn't know you want to be a doctor, you go, you travel, you do some other career, and then you take the medical college application test, the MCAT. And then you get your score. You have 3 years to choose to go to medical school. So most medical schools will honor that score. So say you got another opportunity or you're just not ready to enter medical school yet. So speaking of MCAT, one thing I wanted to let folks know is not to be discouraged by your score, is that there are a number of other application elements that go into choosing an applicant for entrance into medical school. And it can be really daunting thinking that everything holds up on this score. But if you have an application that's got lots of other wonderful qualities and your MCAT score is not quite where you want it to be, it may still be worth applying to medical school anyway. I remember my MCAT score, like I said, I hate standardized tests. It was not great. It wasn't terrible, but it was definitely not at the level where I wanted it to be. And I can remember my advisor actually suggesting against applying to certain medical schools, including Dartmouth, which is where I ended up going. And so it's kind of a lesson that there are many other things that make up your application. And so don't be too discouraged about one test score. But there are lots of ways to support in studying and preparing for the test. So where are we in this process? You've gone to undergrad for 4 years. You've gotten your degree. And at this point, maybe you've taken the MCAT, maybe you haven't. Maybe you've entered one of those post-baccalaureate programs because you needed some extra help. What are some other supports? So there's lots of supports geared to helping particularly underrepresented students become doctors so that we can treat patients in a culturally and sensitive way and manner. And so some of these programs, one in particular I want to highlight is the SNMA, which is the Student National Medical Association. This is an association that's geared towards helping underrepresented students get into the medical field and then support them throughout that. So they have a heavy presence in medical school and residency, but they also have some wonderful pipeline programs to help students who might be thinking about what is a career in medicine? How do I even get into that career in medicine? So I'd encourage you to look into those pipeline programs. As a Native individual, I also want to highlight some of the Native programs available, and there's a couple in particular I want to highlight. One is Indians into Medicine program. This is a program that really helps in the enrollment of American Indians, Alaska Natives into pursuing careers in the healthcare field. They have several things they really help out with, including tutoring, career counseling, scholarship, test preparation, financial aid application, and then some funds to go to conferences. So they're a great program, and they are based out of the University of Wisconsin, University of Arizona, and University of North Dakota. There's another program that's closer to our home on the West Coast. It's a partnership between Oregon Health Sciences University, UC Davis, and Washington State University that is called Reimagine Indians into Medicine, and also is another program to help increase the number of Native medical and health science students. And then very exciting is that as of 2020, there is the first ever tribal affiliated medical school, which is a partnership between Oklahoma State University and the Cherokee Nation. So that is another option. So now you are in medical school, hopefully, and you have had many resources to help you get there. But I want to highlight a couple things in particular, is that one, there's no one pathway. There is certain requirements that everyone needs, but there's so many different ways you can get those requirements. I remember in my class at med school, I had several people who had all these wonderful different life experiences, and we all came together with those experiences and shared them with one another. One of my classmates was a baker in San Francisco for 10 years before she wanted to join medical school. One of my classmates was a business person in China, one was an engineer, and one was an Olympic athlete in his home country of Romania before coming to med school. I went almost straight through, took 1 year off to do research. Part of that decision was I felt very stressed applying to medical school in the last year of my college, so I didn't want to do the whole application process in the fourth year of my college degree. So I took a year. I got a job that I thought would help boost my application, and I was able to apply for medical school during that time and interview. It was really wonderful, and I like it, but looking back, I wonder, would I have taken more time? Could I have taken more time? And I think it's totally okay if you do take time. I wanted to highlight in this talk that each person's journey is their own, and there's no one way to get into medical school, and that all of our experiences help us become the doctor we're going to be and help us treat our patients. And so whatever you take, as long as it is something that's important to you, helps you grow, and helps you stay well, I think that is the path to take. I am very happy to give this talk. I'm very happy to talk to anybody afterwards. If I went over too much and you have a question about any particular part of it, please reach out to me by email. I will make sure you have that information.